Let's get to the Health Minister, Kwekwaji Maimenu, who is addressing a press conference right now.
Dr. Mrs. Martha Jansalucho, she's the Director for Technical Coordination and Acting Chief Director. Next to Dr. Martha Lucho is Dr. Emmanuel Odami. He's the Director of PPNE. Then we have Mrs. Mimi Elise Daku. She's the CEO for Food and Drugs Authority. Then we have Dr. Bano. He is the CEO for HEFRA, that is Health Facilities Regulatory Agency. Then next to Dr. Bano is Dr. Bafwewa. He's an advisor to the minister. Now coming to the left-hand side, I have Dr. Patrick Kuma Awaji. He's the Director General, Ghana Health Service. Next to Dr. Awaji is Mr. Matthew Treme. He's the CEO, acting CEO for Mortuaries Funeral Facilities Agency. Then next to him is Dr. Upoku. He's the registrar for the Allied Health Professions Council. Then I have Mr. Benjamin Inkansa. He's the Director, Infrastructure.
Darrows. BGMC.
Sorry, I have Dr. Ose. He's the CEO for University of Ghana Medical
Center.
That's a press conference that's about to start with the Health Minister addressing the nation on the coronavirus disease. We'll hear the Health Minister shortly. As what it looks like he's starting to speak. We can go to him right now.
We scheduled this meeting for 3 o'clock. As you are aware, the President decided to tour some of our facilities to actually check on our preparedness to satisfy himself with the reports we give him on a daily basis. He carried us to see what is happening in one big port of entry, Kotoka. We followed there to the isolation ward or center at Tema General Hospital, and then we came down to see what we have also in Rich. These are all part of our preparedness, and we'll mention them as we go along. That is what kept us, and then we asked that let us do it at 4 o'clock. Luckily, we finished a bit earlier, so explains the delay, and that is why we are sitting here. So I thank you for coming and waiting for us. Following the declaration of the outbreak of the COVID-19 as a public health emergency of international concern by the World Health Organization on the 30th of January 2020, the ministry has led several efforts aimed at preparedness and response to any potential outbreak. This brief is to provide updates to the Ghanaian people on the outbreak and our preparedness and response in Ghana. The number of cases globally sharply increased from 20,000 cases as of 4 February 2020 to 90,302 as of 2nd March 2020, with 3,085 deaths. So that is the global picture at the moment. We wish to remind ourselves of the following characteristics of the disease. Symptoms include fever, cough, difficulty in breathing, and could be fatal. The disease is spread through droplets, that is coughing and sneezing, close personal unprotected risk by touching or contact with infected persons. Currently, various treatment options are being explored. There is no cure, but treatment is mainly symptomatic. Furthermore, there is no vaccine, and prevention is mainly by adherence to cough and sneezing etiquette and improved personal hygiene, such as regular hand washing with soap and water. In line with the World Health Organization's recommendations to member states to prepare and prevent further international spread of the outbreak by strengthening systems for containment, including active surveillance, early detection, isolation, case and contact management, the following preparedness and response actions have been triggered in our country. A health prevention emergency response team has been constituted by the President to handle the crisis, which has been reporting to the President on a daily basis. The public health emergency management structures at all levels, national, regional, district, have been activated and placed on high alert. The National Technical Coordinating Committee meetings are ongoing. The Emergency Operations Center has been activated and we have met five times. Alerts have been sent to all regions to activate public health emergency management committees to initiate preparedness activities and enhance surveillance for respiratory diseases. Stakeholder engagements have been conducted with the Ghana Health Service, the CEOs of teaching hospitals, including the CEO of the up-and-coming University of Ghana Medical Center, the Christian Hospital Association of Ghana, the private sector, the National Ambulance Service, the Noguchi Memorial Institute for Medical Research, and the Kumasi Center for Collaborative Research, Kutuka International Airport, the World Health Organization, and a number of other donor partners. The ministry has also engaged the Chinese ambassador to Ghana to enhance information sharing and discuss monitoring surveillance activities on returning Chinese nationals into our country. The National Technical Coordinating Committee has met twice to plan coordination and preparedness activities. Monitoring of the national preparedness is being done through the WHO preparedness checklist. The National Public Health Emergency Preparedness Plan has been updated and the COVID-19 preparedness plan has been developed. The Director General of Ghana Health Service has held a meeting with all the regional directors of health services to discuss preparedness activities and planning for the outbreak. The regional public health emergency management committees have been activated and all the regions have updated their plans. Parliamentarians and Select Committee on Health have been briefed on preparedness activities, at least on 2 occasions. Our points of entry. Stakeholder engagements again with the Ghana Airport Company Limited, the Ghana Immigration Services, Customs Division of the Ghana Revenue Authority, and other stakeholders have been held to strengthen COVID-19 preparedness and surveillance at our points of entry. Screening of passengers on arrival has started using thermal scanning and a health declaration form that to be filled by passengers who are arriving at our ports. Staff have been sensitized on case detection and infection prevention and control to undertaking for the heads of the designated points of entry and all Kutuka International Airport staff. Holding room has been identified at Kutuka International Airport to be utilized to hold COVID-19 suspected cases. Training of port health staff from designated points of entry and all staff from Kutuka International Airport. Surveillance. We have adapted and circulated COVID-19 case definition to regional lower levels. We have also adopted a COVID-19 case investigation form and is currently in use. The National Rapid Response Team has been activated. The national level training for rapid response teams and other health workers on severe acute respiratory illnesses has been done. Training of regional and district rapid response teams have been planned for execution. Clinician sensitization, including the private sector members, has been conducted. 40 suspected coronavirus cases have been reported and tested in our country. All 40 have tested negative for COVID-19 from Noguchi Memorial Institute for Medical Research and Kumasi Center for Collaborative Research. These are the 2 big research centers that are doing the tests for us in Ghana at the moment. Procurement of more reagents and primers for confirmation of coronavirus cases is also ongoing. A quarantine center has been established. Another remotely located 100-bed capacity facility is being secured for the purpose of quarantine for eligible persons, and this will be ready for use in 2 weeks. Case management and infection prevention control. Case management protocols for COVID-19 have been adapted from WHO protocols, and these have been disseminated to the regions for further dissemination to the districts and lower facilities. The Greater Accra Regional Hospital and Tema General Hospitals have been designated as treatment and isolation centers. All 5 teaching and 10 regional hospitals have the potential to manage COVID-19 cases. Staff training has been conducted for case management teams. The World Bank is supporting the completion of the Deborah Ward and the 37 military hospital. This is a 25-bed capacity infectious disease center with modern facilities, and this facility will be ready in 3 weeks. Risk communication and social mobilization. Media briefing has been conducted on prepared activities. We have had one here earlier. Key messages and educational materials on coronavirus preparedness and preventive measures have been developed and are being disseminated at the moment. Soon a lot of them will come to you. Preventive messages on COVID-19 have been developed and being broadcast on airport screens. 4 press releases on COVID-19 have been issued by the ministry. Information on the evolution of the outbreak globally, the clinical symptoms, directions on prevention and measures being taken within the country to early detect and manage possible cases. Updates on the country's preparedness activities and on cases suspected and tested. Radio and television discussions and engagements on the outbreak and Ghana's preparedness activities by Ghana Health Service officials are also ongoing. Jingles have also been developed for the regions, the districts, and are being disseminated again at the moment. Regional risk communication and social mobilization training are also ongoing. Dedicated lines have been given to the general public to report suspected cases of COVID-19. Let me take a little bit of time to go gradually over some of the phone lines that are toll-free that people can use to call when they find a suspected person or when somebody is distressed. 055 22 22 004. 055 22 22 and 005. The next number 050 94 97 700. It's another 055 84 39 868 and 0800110555. It's a toll-free line that you can use to reach us. Alternatively, text messages can be sent to the short code 199. Our logistics situation. So far, 5,000 personal protective equipment have been procured and distributed to all regions and major health facilities, as well as points of entry, teaching hospitals, and treatment centers and selected health facilities. Additional protective equipment has been procured, and I will soon take delivery and continue to distribute them. Let me use this opportunity to provide advice to the general public that due to the nature of this outbreak, it is imperative that the general public continue to observe the following preventive measures. Regular washing of hands with soap and water. But this is very, very, very important. Use of alcohol hand rub where available. And in the meantime, our traditional handshaking culture must now be avoided as much as possible. Let me go over that. In the meantime, our traditional handshaking culture must now be avoided as much as possible. Keep a distance of at least 1 meter from a person showing signs of fever, cough, and difficulty in breathing. When in contact with a sick person or with potentially infected surfaces or objects, it is advised that you refrain from touching your eyes, nose, or mouth with unwashed hands. And people should seek treatment immediately at the nearest health facility if infection is suspected, if symptoms occur, or upon advice by a health worker. People from affected countries who develop symptoms should stay at home and call the helplines for advice and necessary action. We strongly again advise that non-essential travel to and from affected areas should be discouraged. Let me go over this again. We strongly advise that non-essential travel to and from affected areas should be discouraged. And let me commend the group that does buying and selling, the gov't group, for they themselves coming out to advise their members to reduce their trips or going to bring their wares, at least for now, so that they don't move up and down within the system of global challenges. The Ministry of Health continues to work with the development partners to monitor the situation and further strengthen systems to prevent the introduction of the outbreak in Ghana and early detect and contain it if it should occur. In conclusion, I wish to indicate that the government is doing everything possible to prevent and protect against the outbreak and spread of the infection in Ghana. This is being done in collaboration with our development partners. I wish to express my utmost gratitude to all development partners for their continued support. We are in this together, and therefore call on the private sector and development partners to give their full support to our national effort in this period of preparedness. I thank you so much.
Thank you very much, Honorable Minister. We shall now invite the media to ask the questions that bothering you. So the rule is simple. You mention your name, your media house, and then the question. And I think that we shall restrict ourselves to one question each. Then maybe come to the next round.
Looking for a pen. Okay.
My name is Preparedness from JoyNews. I wish that to give me the opportunity. I'm limited to one. I'll ask you about the measures you have at our land borders, because you mentioned what we've done at the airports. We don't know yet what the measures are at the land borders, so you can update us. And at last, okay. I also want to know about this person who came into the country and showed signs of the virus, was tested, and it turned out to be negative. Traveled to Kumasi, and we understand the person died. We're told that he did not die of coronavirus, but we want to know what killed him.
When you're postmortem reporting,
it's private. It's not. It is not. It is not.
Dr. Wachi, you answer that one.
You cannot tell what killed somebody.
Good evening. I'm Nana Kwesi. I'm from Man FM. Honorable, I would like to know your meeting with the Chinese ambassador on returning of their nationals. Is it the case that they've halt the returning of their nationals into Ghana? Or I want a further explanation on that. Thank you.
Okay. Let me start with the Chinese ambassador's area. A number of cities are locked down in China. Not only there, Some other outside China sort of centers like Italy, cities have been locked down. People are not allowed to move in or out of these places. When we met with the Chinese ambassador sometime last week or so, the indication is that they have started advising their citizens who, for some reason, come into the country to do their own self-quarantine. Our engagement with the ambassador on a continuous basis is for information sharing, for them to be able to, if possible, alert us of where some of their people have come and where they are, so that we can track and do the type of work you need to do with them. They are filling forms at the airport, so if you find them, we move in to make sure that they actually are observing the instructions on self-quarantine. We are also working together with the national security, who are also tracking some of the suspected people arriving from centers that have been affected, so that we can track and check on them. So that is being done very efficiently. The same measures that we have put in place in the Kotoka International Airport are the same things that we are replicating along all the land borders, especially the two major ones, Elubo and Aflao. But we haven't forgotten about the approved routes across length and breadth of our country, as far as Paga, the Gonokrom and Badukrom and the Sampa area, everywhere across the country, we are on high alert. And now we have got some of our directors who are moving around to actually check, just like the president went around this afternoon, to make sure that they have taken our advice and instructions very seriously, and they are working on them. And that's why the Kumasi case, I will allow the Director General for Ghana Health Service to address that matter.
Thank you very much. The Kumasi case, someone who came from Germany did not meet the case definition through the airport, went to Kumasi, fell ill, and it was because of the temperature and the respiratory conditions, it was a probable case. But when the test came, it was negative. I can't tell you, it's still a private matter. This is somebody who didn't die from a condition of public health interest, and so we cannot give you that kind of private information as to what really killed them.
But this is part of their ethics, so you don't disclose somebody's cause of death to the public domain. Even to family members, you may need some permission from one or two. Other than that, we can't disclose. But what we know is that the death was not caused by coronavirus. We did two tests, one at KCCR, the Kumasi Research Center, and then we repeated the same test with another sample from swab from the person at Noguchi. And Noguchi, you know, is the most efficient laboratory, at least within the sub-Saharan African system. And it's a very huge facility, so they can't go wrong, at least for now.
Thank you very much, Honorable Minister. We are inviting more.
This will be a short conference.
My name is Yawodi from whatever. Honorable Minister, my question is, countries like Kenya are suspended flights from China. Will Ghana also do that? Thank you. Thank you very much, Honorable. My name is Eko Moses. I report for Bloomberg. This is my first time, so pardon me if you handle all these questions already. How much in total have you set aside to address this issue? And two, have you roped in private sector? Have you? If yes, maybe some of them, have they also made any commitments towards this fight? Now, there is a multiple school of thought regarding the incubation period for this disease or virus we're talking about. Some talk about 2 weeks, others mention as far as 27 days. which one is it? And if you could give us some clarity,
You answer this question.
It helps. And maybe you also said is it 4 or 40 cases that you have tested that were all negative?
40.
40. Thank you. And maybe finally, this is just maybe a PR thing also. Can you tell us that at any point in time, this group, maybe led by your good self, would be the only person to, in the unlikely situation that we have a case, do the announcement, such that my colleague and myself, media men, will not be running with some sources, somebody say who announced certain things, and we always have to come and do firefighting. Given that it goes through test after test, it goes through a process before an official announcement. So if you could harp on that for us, that at any point it should come from members of this table, hopefully at a press conference before an official case should be deemed credible. At least this is just some of my colleagues. Thank you.
You will do the incubation period matter. Another one.
Camila from Daily newspaper. Honorable Minister, I'd like to know the location for the 100-bed capacity facility. I would also like to know the treatment protocol should the country record a case. And finally, the WHO
What question did she ask? The second
in the
one.
report stated that the country needed about 35 million Ghana cedis in its preparedness. And we heard that government had also allocated initial amount of 2.8. How far are we with generating of funds to prepare for any case? And then finally, you said more PPEs are going to be imported. When are they arriving and how many are coming? Thank you.
Thank you very much. The PPEs that we are going to take are not coming from our side. We have them in stock in somebody's warehouse that is delivering to us. We were lucky in that respect. So we don't have much challenges with them. Where do you live, madam? Nungwa. So if I tell you that the 100-bed capacity quarantine place is behind your house, will you go home tonight? Oh, be very honest. Sure. Okay. Some of us may not want to go home if you announce that the facility is behind their houses. So in these instances, there are certain things that are kept quiet and people shouldn't know where we are. So we are not announcing where these places are, just to make sure that we don't get unnecessary agitations and pressure on us. We saw some Chinese who had come into their system, and the community, where they were, there is a community that reported the matter to us, even on telephone, that some Chinese have come hiding themselves here. So we, together with National Security, went in there, and when we went there, they have introduced their own self-quarantine protocols. We went over it, and what we did was that we satisfied somewhat and linked them to our, how do I call it, health people in that area to be checking their temperatures from time to time until the 2 weeks. And we are adding one buffer, 1 week expires before we allow them to come out of their self-quarantine area. And so far, we didn't have any problem. We haven't had any problem from that. So the community people are also doing their own surveillance, and when there are issues, they will come and report to us. So the location, I'm afraid, we can't disclose, not even to the president at the moment. As for that one, we and him know what to do, but we don't even want him to know, at least for now. But we are seriously working on it, and we've got a facility already completed. The World Bank is supporting us to procure, and we are putting in beds, and that is why we said in 2 weeks. If it happens that there's a surge, we can immediately take people to actually move in there tomorrow morning. Budgetary allocations, you asked questions about that. We did an initial budget of 35 million. We got a seed money of 2.8. We have got indication of another release of 11 million. And this morning, aside these two tranches, the finance minister had met with the governor of Bank of Ghana. They called me on a telephone conference meeting, and we have to send a team from our side to go and meet finance people to discuss a comprehensive budget with a view of trying to search for more resources to put at our disposal to do this fight. So when it comes to resources, it looks like we are on course, and what we need, we are likely to take. And that answers the budgetary allocation question my brother here asked. Flights from China. Ghana, so far as I'm aware, has not stopped flights from China. And let me tell you again, there are no direct flights from China to Accra. They're all transit. But even in China, so China is a very huge country. Wuhan is an area which does not cover what percentage of the landmass of China and its people. So normal economic activities are ongoing in several other parts of China. And therefore, Kenya cannot stop flights coming from about 2,000 kilometers away from Wuhan, where they haven't found a case and what have you. But even now, Kenya, if Kenya suspends flights from China and continue to take in flights from Italy, what difference does it make? So one has to be careful about what you do. But Ghana hasn't suspended, only that we are a little bit more critical with people we are encountering on our information, forms that they fill, but where they are coming from. That is our critical area. So if you are coming from places that have been affected, we put a more critical eye on you and strengthen our data collection from you so that we can track you to have this thing. We have actually invited the private sector people to come to support us, just like our donors, but we haven't had a single indication from the big private sector person who is coming, but we have actually invited them. Even when I was delivering my address, I made mention that we are inviting everybody on board to support us. So if there's a private sector person you know who can support us, but he wants us to come and talk to him, please alert us. We will so quickly do. I think these are the questions that I can answer. And I'll leave the incubation period question to Dr. Awaji.
Yeah, thank you very much. We have international standards. We have centers where research goes on. And we have CDC, we have WHO. And CDC actually recommends 10 days. WHO talks about 14 days. And we are taking this year by taking the 14 days, which is a longer period for us. Any other person may probably not have a very good scientific basis to making it 27 days or not. And that person has not been able to prove how he got 27 days. So for now, we choose the 14 days.
That's okay. The last one I want to answer will be the announcement, if there should be a confirmed case. That announcement can only come from the Minister for Health. So any information, anything that you get from any other source, you don't use that one. You wait for the announcement from the minister. If you want to be more inquisitive, you can poach us and confirm whether what they are saying is correct or not. But don't just go on hearsay that this is what is happening. As we speak now, we have actually detailed a very well-renowned person to join a meeting of members of the Ghana Medical Association to discuss with them as to what people put on the, how do I call it, in the media. You see, all doctors have a lot of knowledge about this disease, but as to how we are managing the problem to actually avoid causing fear and panic unnecessarily, to actually avoid people thinking that the disease is here but it's not here. And I'm talking across purposes. We are pleading with professionals, even professionals, to be circumspect in the way they put information in the media landscape, because this is a very serious matter and we must manage communication in that respect. So by international practice and global good practices, I think even by rules of engagement, it is the Minister for Health who should actually announce this emergency if you should have a confirmed case in our country. If you watch international media landscape, you see all the time it is the WHO Director General who declares pandemic or whatever it is like. You know, in other countries, Iran case, the Minister for Health was announcing, wherever it is, that is what it is. The president or the minister, America, the president is announcing. So we must take information from the right source before we begin to disseminate that information. I think that is about all for now. Please.
Yes. Thank you. And in line with that, apart from the major announcement, Ghana Health Center has also put out 3 names of people who can speak, whether it's on radio discussions or if you want to call for information. We also mindful, that's why we are giving you those 3 names. But those people can also, depend on the section that you want to talk about, can designate, because you don't want to create a situation where people create panic, people who do not have the appropriate knowledge also speaks on the matter. So I think we're very happy if that can be respected. We send a circular to all media houses about the people who can officially speak on the matter. Thank you. Myself, Dr. Bedusa Akode, the Director of Public Health, Dr. C.L. Queen, the Deputy and Head of Surveillance, and of course can be coordinated by the PRO, that is who would be able to give you anybody based on the subject who the service has designated to be able to communicate as far as COVID-19 is concerned.
I think we'll ask our PRO to actually find a way to communicate these names and their contacts to the media, saying that those who are looking for proper, efficient information can source from these gentlemen. Unless, of course, we actually authorize somebody to go and sit on a radio station to talk. Other than that, we should be circumspect in our reportage. That's about all.
Because last week we sent the problem, realized everybody was talking about.
Earlier, we were made to understand that the mode of transmission of the virus can be transferred from animals to human. If that's the case, we are securing our entry points, the borders, and the airport. But we also have some birds, some animals that fly to Europe and some other parts that they've recorded the disease. How are you handling such case? And also to FDA on importation of meats into the country. How are you also monitoring it? Then finally, are we safe to consume the bush meat? Thank you.
I think it's okay. I'll respond on the virus transmission.
Okay. Eric Fedemati from TV Africa. Please, concerning what you said about the place where the quarantine will take place, you said you want to disclose that one to anybody. Is it because of that when the Ebola came, the previous government prepared a facility for that? And if I know of one at the Majero Hospital, there's one there. Is it because you don't want people to know that that place is also part that you don't want to mention? Or why do you want to do another one? If those ones are already there.
That's a treatment center, not a house.
Okay. It's okay.
That's all. Okay. Honorable.
It's okay. You answer all this straight together.
Look, those of us in tropics who have survived malaria and what have you, do we have any antibodies that sort of predispose us to fight it better, not to say anything, than say our European people who are living in quote a cleaner, less troublesome malaria, cholera, and what have you? Does it have any place here? Thank you.
So for this one, we are still studying.
Yeah. Yes, I'm going to, okay.
I'm going to ask Dr. Boaji to answer these questions.
Thank you very much. I'll take the animal transmission. Yes, we have diseases that can be transmitted from animals to humans. And that is why we continue mentioning the fact that we need to treat the process of animals properly, cool them well before. But before the virus can move from human to human, that virus needs to make a change. It doesn't always happen. And if that did not take place, you would not have had a human-to-human transmission as happened. So that still is a threat. But it's not very easy for the virus to change its mode to be able to move from human to human. So, and from human to human. No. Animal to human can happen if you don't handle them properly. But then that will be for the person. But before that virus can move from one human to another, it needs to change. Be able to do that. It doesn't happen very often, and that's why we have it. So you still have to play caution in all those, in any animal you meet, and everything has to be treated quite well. The other one was what was the other question?
The antibodies.
Antibodies, no. Genetically, we are the same gene profile, everything is nearly the same. But
so it is still being studied.
we are not the only African country. I mean, there are other parts of Europe, especially if you look at the spread, it's more in the central belt. There are parts of Arctic Sea and also where the viruses are not there. And besides, one of the students who got a virus in China was a Cameroonian. So we are not immune in any way, except that if you do not come in contact with the virus, you will not. Maybe we have been so far been lucky. Maybe the traffic into this country is not as heavy as other countries where it's a hub for many people coming in and leaving. And that's what it is. That's why we are taking the issue of early detection at our borders and containment as the best strategy. Because if it comes in, nobody is immune. There's nothing genetic that protects us. That makes a difference from any other person.
To add to what the DJ has said regarding the antibody case, COVID-19 is a novel virus and therefore is still being studied. And whether the black genes is able to tolerate it more or be able to ward it away is still being studied. So as often as the information comes close, we will let you know. Thank you very much. I think the FDA has a question.
Yeah.
The meat.
I think the question was on
meat importation.
Importation of meat is in reference to coronavirus. I think viruses are known to only survive for a very short time on objects that are not alive. So I don't think you can get coronavirus from eating meat, because meat that is coming in is not an animal. It's been killed, it's been frozen, so a virus cannot survive on it. If any other animals are affected for any other reason, the appropriate authorities like the will let us know, but not coronavirus.
Can I take the... let me advise. I hear people are going around saying that this cannot infect black people. Please, let Ghanaians understand that researchers have not even found the nature of this virus. They haven't even been able to develop a vaccine yet, since December. So nobody knows the nature. So nobody should sit anywhere and allow another person to fool you that it cannot affect black people. Again, you were talking about having survived malaria. That is a very huge statement. We have not survived malaria. Malaria is still a very big disease that kills us more than any other disease in Africa, especially sub-Saharan Africa. So we have not survived malaria yet. And we don't have any antibodies that can fight this virus. So just let us adhere to etiquettes from coughing and sneezing and listen to the advice the experts are giving to us and abide by them. I think that will help us quite a lot. There was this question on quarantine and treatment center. The quarantine center is different from a treatment center. Those of us who joined with the president this afternoon to see the treatment center, one at Tema General Hospital and the other one in Ridge, they are different from the quarantine centers. The quarantine centers can be a hotel. You haven't got infected with the disease yet, but because of where you are coming from, we want to, because of exposure, we want to monitor you for the incubation period of 2 weeks. And when we don't find anything with you, then you get released. Those of us who listen to international news about the cruise ship that was docked in Tokyo, they were quarantined until they began to see evidence of infection. You see, so we keep them there. And where we keep these people is where we don't want people to know, but not the treatment center. So that is what it is. Okay, I think we've exhausted the questions, and I'll hand over to the PRO.
Thank you. Thank you very much.
Kwajima there addressing a press conference with his health lieutenants there. He talked a lot about our point of entry and what we're doing to protect those. He talked about surveillance, and he said that 40 cases so far have been tested. All of them have tested negative. Well, we heard from Elton say that there's one more on the way to Noguchi at the moment. He talked about logistics, said 5,000 PPEs have been procured, and what ought to be done about keeping what ought to be done for you to keep yourself safe. He talks about keeping a distance from those you suspect may have the signs. Do not touch your mouth, do not touch your nose, your eyes, etc. Then he talks about a group of Chinese people that apparently came into the country, and they said national security went in, they checked on these people, and they have set in their own self-quarantine protocols.